Let's start it. Oh gosh.
What did you do?
Well, I don't know.
Oh.
I'm trying. It's spinning.
I think we're live anyway, though.
I know, but I was gonna set it up so we could see comments.
Oh.
I thought. Okay, maybe.
Is it down?
No, I mean it looks like there's a spot on the side. I don't know.
Okay.
What's
we
happening
should be able
here?
To see. What do you
It's
mean?
like cutting off my head.
Why did you do that?
I don't know. I don't know. It's our production team's
Good.
fault. No, it's just crooked, but that's okay.
You need to come over this way more. We've got
Gotta
way
snuggle
more
more.
room over here.
Snuggle more.
There.
Hey, hey, girl.
Harley says, "Hey, Kelly."
Harley. It's ridiculous. This is Harley. I think he's been on the live before.
Yeah, I think once before. He's the most ridiculous dog I've ever met.
Boop. No kisses though, because you were drinking out of the toilet.
He was.
Oh goodness. So today we're talking about surgeries. Yay! So what happens kind of like after you drop your pet off for surgery? What is it exactly that we're doing other than just the surgery itself?
Yeah.
That's obvious. But
do we want to start like from the very beginning? Like when you call and
it's
say,
a very
"Hey."
good place to start.
Yeah, at the very beginning. Yeah. He's just gonna kick me in my face the whole
It's
time.
fine. It's all right.
So Dr. Hogan likes to see your pet before we get them in for surgery.
But why? Pourquoi?
Well, I don't know. You tell us why. No. So typically when you call and you're like, "Hey, I want to get my cat or dog in for even just like a routine spay or neuter," she wants to see them first. And a couple reasons why is first we want to make sure that there's nothing else going on. They don't have an ear infection or maybe like a broken tooth or something like that that needs to be addressed as well. We also, especially with the boys, want to make sure that they're not cryptorchid. Explain to us what that is.
So cryptorchid means hidden testicle. So meaning that one of the testicles, one or both of the testicles, is actually up in the abdomen instead of in the scrotum where it belongs. So sometimes that happens. It's not super common, but it is a thing, and not a thing that you want to be surprised by the day of surgery. Like, oh, surprise, now we're all of a sudden having to go into their abdomen, which is very different. So,
yes.
Yeah.
And it does add extra cost because we're going into their belly instead of just, the scrotum area.
Right.
So, that leads me into the second reason why we want to do that. So we like to get you a treatment plan before surgery so that, like, morning of, you're not going, "Oh my gosh, it's, $300 or whatever," when you were expecting something more of like $100. Because everywhere does things differently. Some veterinary clinics don't place IV catheters, or I guess some places may not intubate as well. I don't know.
Yeah, surgery is a weird one that there's not necessarily one way of doing things. And so that's why sometimes the price can vary quite a bit. Because the $25 spay at like Carroll House Quick Fix is very different than our spay here, and that's why there's a big difference in price. And so I think
Exactly.
just understanding if you're just calling around just getting prices, trying to find the cheapest place, ask. There's questions to ask about that, depending on how comfortable you are with certain risks and things. So, yeah.
So we'll get you a as up-to-date treatment plan as we can. Things do come up, especially with dentals. Not every dog will let you open their mouth like this and look in there to see what's going on.
Or he's like, "Just touch me. I don't care."
He doesn't care about anything.
I don't care. Hold me like a baby.
Yeah. So, not every dog is going to let you do that or even like look in their mouth. So it's good for us to get kind of a baseline of what kind of dental disease we're looking at so that we can get you a treatment plan based off of your dog's specific dental needs. So people will call us and they want to know, how much is it for a dental? I can't really tell you that over the
we're
phone.
like, it could be anywhere from $200 to $800 or $1,000. I don't know.
Yeah. Does your dog just need a routine
and most
cleaning?
people aren't really happy with that range.
Yeah. Does your dog need a routine cleaning, or does it need most of its teeth or all of them extracted? You know, depending on the level, excuse me, of dental disease. We don't know that. We don't know how much it's going to be. So yeah, those are at least 2 reasons why we want to see your pet prior to surgery.
Yeah.
And then you bring them in to drop them off for surgery. We'll go over paperwork with you.
What paperwork, Crystal?
Well, I was going to get into that. You're getting too antsy on me.
I get all excited.
You're not the one doing most of the talking this time. Do you have RBF over there?
No, I'm smiling.
Oh, I haven't looked. So you drop off your pet in the morning. We bring out some paperwork. So the top sheet that we give you is going to be the treatment plan. And that should be what we've already gone over with you. So if you have any questions, definitely ask us. And the second sheet is going to go over things like what medication is your pet on? When did they last take it? This is my life.
I know.
When did they last take that medication? When did they last eat?
Yes.
A good phone number that we can reach you at the day of surgery. Please leave a number that we can reach you at.
That's kind of the point.
I know.
It's a number that we can reach you at. Because really, majority of the times that we're calling that number is just to let them know that everything's fine and we're out of surgery and everything. But I would say greater than 50% of the time, whoever I'm calling doesn't answer. And I'm like, well, if this was an actual emergency that I needed to reach somebody, that would be really bad. Yeah. So while it's rare that we would need to contact someone in an emergency, it's still important.
It happens.
A number that we can reach you at.
Yeah.
Not just a phone number.
And if we do call, here's just the pro tip. If we do call, listen to your voicemail.
Pro tip. If we leave you a voicemail.
Your dad says the dog is cracking me up. He's ridiculous.
Harley is ridiculous.
He is the most ridiculous thing I've ever met.
He's just going to keep kicking Crystal in the face.
Yeah. I mean, that's what he does at home, too.
It's fine. And then he looks at me like, what are you doing? Why aren't you petting me? Oh, man.
So, yeah, just listen to your voicemail. Everything that you need to know about what we called you about is in the voicemail.
Typically, yeah.
That is just a pet peeve of mine, so I wanted to throw that out there.
Well, yeah, that's the thing. Like, they don't answer the phone, so we leave them a message, and then they call back. Sometimes it's immediately. Sometimes they didn't even wait to see if there was a message, which, okay. But sometimes it's like a few hours later.
Yeah.
And we're like, so you listen to that voicemail?
Oh, no, I didn't even check. What do you mean you didn't check? It should pop up on your phone that you had a voicemail. At least it does for me.
It does for me.
I don't know.
To be fair, I never answer my phone.
No, you don't.
Especially if it's a number I don't recognize. I don't answer my phone. I wait and see what the voicemail is, if they even leave a voicemail, because let's be real, half the time it's like some salesperson calling. Yeah. And then I'll see if they left a voicemail. Even if she calls and I miss the call, I'm like, she'll leave me a voicemail? No? It probably wasn't important then.
That's fair.
That's how I roll.
75% of the time that I call her, she doesn't answer her phone.
No. Answer my phone. Don't call me.
Don't call me. I'll call you. So yes, it'll ask what number you want to be reached at. Do you want us to call you? Do you want us to text you? And then it'll go over like any additional things that you need done. This is where you put like anal glands or check ears or something like that. We typically do their nails while they're under anesthesia anyway.
Yeah.
Let's see. I think that, if you want your pet microchipped, I think that's it on the second page. So the third page is then going to go over things such as in a emergency type situation. So there's 3 options. The first option on there it says, you know, do you want us to do anything necessary to keep your pet healthy and living if something does happen?
That was a weird way to word that.
Well, and alive.
Well, you know, do you want CPR done?
Yeah.
So if your animal was to code under anesthesia, I mean, this is the same thing as that you sign for yourself, or if you have kids that are going into surgery. It's the exact same thing. So do you want CPR done? Okay, cool. And, you know, the first one is like, yeah, do
I thought I was
anything. Well, you weren't telling it well. The first one is do anything and everything possible. The second choice is do CPR, but only up to a certain dollar amount. And it's adorable when the people are like, up to like $10,000 or something like that. And I'm like, oh, that's cute. There's nothing that we do here that would be that much ever.
No.
But that's okay. That's fine. That gives us our parameters. That's fine. Or the third option is a DNR. So don't try to resuscitate them at all. So yeah, the options, it says pick one.
Choose one.
Pick just one.
There are so many people that pick the first and the second one. I'm like,
I don't know what
no. Which one do you want? Do you want us to do anything that we need to do regardless of additional costs, or do you want us to do only up to a certain dollar amount? Those are your options.
Or they'll pick the second one and don't put in a dollar amount.
Yeah.
Like,
do we just
really
guess?
sure what to do with that either.
Yeah.
Cool.
Yeah.
And it's because they're nervous. They're here. You know, they're dropping off their pet for surgery. They're nervous. They're not reading thoroughly, I'm sure. But yeah, pick one.
I mean, with anesthesia, and this is why we go over the treatment or all the paperwork and stuff, there's always a risk when you put your pet under anesthesia, regardless of how many times they have had surgery.
Correct.
You know, and we try to make everyone aware of that, and we do as much as we can before surgery to make sure that they're healthy enough, which is why we do the pre-surgical blood work, and it's not optional. If you don't get pre-surgical blood work, you are not getting surgery here. And a lot of people, well, I wouldn't say a lot of people. There are some people that are unhappy about that because there is an additional cost associated with that, but it's not optional.
Correct.
And there have been times where we will do the pre-surgical blood work and we're like, we're not doing surgery on this dog today because they have another underlying condition.
Right.
And that's happened several times.
Yeah, it's not something that happens a lot, but it is something that happens. And so, yeah, or, you know, other times where we're like, oh, you know, this is off, and so we need, you know, maybe we're not going to do certain medications, or maybe we want to give them some fluids before surgery and continue them after surgery. There's things that we pick up with that need, you know, sometimes it doesn't mean they're not having surgery, but sometimes it just means that there's adjustments that we make to our typical protocols, and so yeah, that's why we do that.
Yep. Let's see.
So they fill out all the paperwork.
Yeah.
Dentals, we have you tell us. So again, you know, we want you leaving us a number where you can actually be reached. But in the event that you cannot be reached, we ask you to tell us what you want us to do if we find additional dental disease. So is there an additional tooth that needs to be extracted? Or is there some, you know, like a mass that we find? You know, what do you want us to do with that? And so again, 3 options. One is do absolutely nothing unless we talk to you and get permission. And you understand that if there's something else that needs to be done, we may have to do a second anesthesia, so then it'll be more costly later. Option 2 is you could do things, but only up to a certain dollar amount. Cool. Or option 3 is just do whatever we think is medically necessary. What is appropriate, regardless of cost? So yeah, we have you pick one of the, pick one.
Pick one.
Just pick one. So yeah, so then once you have your paperwork all filled out, then one of our lovely technicians, one of these peoples.
Well, not one of the other lovely technicians. I'm just a technician.
She's just a technician. She's not a lovely technician. Will bring your pet to the treatment area where we will draw blood for their pre-surgical blood work. So we run that the day of, because that way it's as recent as humanly possible. Because, we had our last clinic, they would send everything out to the outside lab, which, cool, but the downside is then we're like, well, it's good for 60 days. Well, what happens at day 61 or day 70? And, people fight you on that and all that. So we're just, it's just easier, just do it the day of. We have the in-house machines, let's use them.
Mm-hmm.
And that way it's as recent as it can possibly be and as accurate as it can be. So, so we do that the morning of. So that's why we want your pet here before surgery too, so that we can get those sorts of things taken care of, make sure that that's all good, because that takes time to do that. We get, we weigh them. Even if they were here a week ago, we still re-weigh them. They have drugs, all their anesthetic drugs and everything gets all pulled up and ready to go, because we try to keep it very organized, because that's the best way to keep it as safe as possible.
Otherwise, things get lost in communication.
And
who's here and who's not here, and we make sure that their weight is updated, and so we pull their drugs up the morning of surgery so that it's as accurate to their weight as possible.
Yep.
And then that way we know all of the drugs are ready to go. We're not waiting, 2 hours later, Fluffy shows up and now we have to get drugs for Fluffy while we're trying to do surgery on this other dog. And it gets to be too much.
Yeah.
There's already a lot going on with surgery days. So the flow, if we can keep the flow going, it makes things a little bit easier.
Yeah. And it's the same reason, again, this is why when you have surgery, they have you come at whatever time in the morning, and you may sit there for a few hours, waiting your turn.
Or all day.
But that's why. And they're getting some things ready, and they're making sure everything is prepped, organized, good to go, checking off their little checklists and everything, and just making sure everything is as it should be. So there's no surprises.
Surprise!
Surprise! So then like we said, make sure blood work is all good. Okay, that's all cool. So then we can get, the drugs and everything ready to go, because they get a whole little cocktail of drugs. They get cocktails in the morning.
I'm jealous. I don't want a cocktail in the morning.
It's typically a combination of like a sedative and some pain medication. So they do get pain meds before we even start doing the painful things, because that is the best way to treat pain, is to prevent it. They get a whole little cocktail depending on their age and health status and, any concurrent diseases or things that might be happening. Those medications can change, or the doses can change. And then we're ready to go. We start patient number 1. So they get their pre-medication cocktail of anesthetics. So this is just a sedation with the pain medicine. We let them get a little drunk. Usually takes about 10-15 minutes or so.
They get nice and sleepy.
Feeling real good.
They don't really care about what's going on.
No.
They're
They're out at that point. That's lovely. It's just like stretching. So then they go get their IV catheter placed. So all surgeries get an IV catheter placed as well. Why is that, Crystal?
So that we have instant access to the vein if we need to give them like a reversal agent. So if we need to reverse their sedation for some reason, if they need extra fluids, or we give them IV fluids while they're under anesthesia.
Yep.
But
cat neuters, because they take like 2 minutes.
Yeah.
But they get a catheter, they just don't get the fluids.
Yeah. We give them a little bolus.
They just get like a little syringe full.
Yeah.
So they get fluids during surgery, so that goes through their IV catheter. Their actual anesthetic, which is propofol, is what we typically use. That's given IV as well, so that goes into that catheter.
Yeah.
Get any emergency drugs if we were to need something like that. Instant access. Right there. Because you don't want to be messing around trying to hit a vein. Like when you have an emergency situation, that's craziness. place that IV catheter, you're good to go. So that's why your animal will have a little shaved leg. That will happen because that's where their IV catheter was. So so we do that. Then we give them their propofol. So now they're
no.
Oh,
they
sorry.
get pre-oxygenated.
Oh, well, yes, that's
Explain
true.
to us why that happens.
So pre-oxygenated, meaning that while they're getting all snoozy and relaxed, they get a mask with oxygen flowing. It's just like this.
That's exactly what
That's
it looks
exactly
like.
what it looks like. So it's just oxygen. So what that is doing, I was doing it.
Okay.
What that is doing is, so it's pure oxygen rather than just breathing in room air. So that means their red blood cells are carrying more oxygen than normal. So that means that when they are first under anesthesia and they're not breathing as well as they normally would, we've got a little extra buffer time for them to kind of catch up and for their body to kind of adjust in that. So we're not worried about their oxygen levels in their blood being too low in those first couple of minutes because we've already pre-oxygenated them. They've already got extra on board. So they're good for a little bit of extra time. So it's just safer. See, that's why we do that. So 2 to 5 minutes or so, or sometimes we'll just have it on while we're placing that IV catheter. It just depends.
Yeah.
Depends on how cooperative they are.
Sometimes they don't.
Because
like the
they're
mask.
sedated, but they're still, some of them still really hate it. Because it's weird. We're putting their heads in those big
And
plastic
it's a little bit cold.
Yeah,
the
it's cold.
oxygen when it comes out.
Mhm. Yeah. So sometimes they're not super cooperative, so we have to do that after the catheter is placed. But sometimes we'll do it during catheter placement too.
She's like, what's happening?
Errands people. So then they get their propofol. So that means that they are completely anesthetized, so not conscious at all. And then they get their breathing tube. So they also all get breathing tubes, endotracheal tubes. Pardon me. So that goes, just like people get intubated, same sort of thing. It's a tube that goes into their windpipe, and then they get hooked up to the anesthetic machine, which delivers oxygen and gas anesthetic to keep them sleepy. Because that propofol wears off pretty quickly. So it could be used. We could do intermittent injections of propofol. It's not ideal. Plus, it's nice to have their airway secured. They're cuffed. Endotracheal tubes mean they have a little balloon on them. So if they were to regurgitate while under anesthesia, they're not sucking that into their lungs because that would be bad. And again, another emergency situation happens. We need to give them breaths or something like that. That tube is already in place. We have instant access to be able to give them breaths directly into their lungs.
You were drinking toilet water. I don't want
He
that.
was drinking toilet water. So rather than, if you watch TV shows, they have the little mask thing with the bag, the ambu bag. That doesn't work great. It's fine if you don't have an airway secured, but ideally they would be intubated. So that's why they all get intubated. Yep.
Going straight into their lungs.
Straight into those lungs. And two, all the brachycephalic breeds, the little smush-nosed guys, like the French bulldogs and the pugs and all those sorts of kids, they don't breathe great normally. When they're under anesthesia, they're definitely not going to breathe great. But I will tell you, so when we put that tube in, great, now they can breathe fabulously. In fact, they really enjoy it, and they usually take a really long time to give up their tube.
Yeah.
So
they don't want it to go.
Typically when we are finished with surgery, we wait for them to be light, out of the anesthesia enough. We call it light enough to give us a couple swallows. It means that they, have their reflexes back and they can control their airway on their own. So then we'll pull the tube, except in the brachycephalic breeds. Those guys, we really wait for them to be fighting that tube and really hate it before we pull it. Because they have all kinds of upper airway abnormalities that's just kind of breed standard.
It always makes me really sad.
That while that tube is in, that's the best that they have ever and probably will ever breathe in their entire lives. So they'll sit up and that tube's hanging out their mouth and they're just like, what guys?
Hey,
What?
how's it going? This is great.
This is great, guys. Keep this.
And I'm like,
Can I hold on to this?
I'm so sorry, friend.
So we either wait till they're basically physically up walking, or they're just really fighting it and coughing and pawing at it, things like that. So we wait for them to be very awake before we pull that tube. Because again, when everything is relaxed, that includes the airway, and when you already have an abnormal airway, that's not great. So yeah, they get to keep that tube. I would rather them try to bite a tube and throw it away, because we dispose of the tubes between the patients anyway. I would rather throw away a tube than worry about a patient not breathing properly.
Yeah. That's another thing. They all get brand new endotracheal tubes.
Which sounds like, yeah, I mean, it sounds like a silly thing. I mean, they're not expensive. But, rather than worrying about,
I mean, the last
is it tube cleaned properly?
They were not.
Yeah.
We would reuse them many times and just check to make sure.
And a lot of places do that.
Yeah.
And I've heard people say, well, they don't want to waste them. And I get it for sure. But I also think, just from like a sanitation standpoint, better to have a fresh new tube.
Well, and like you said, they're cheap enough.
They're cheap. They're less than $2.
Yeah.
Most of them. I think some of the bigger sizes are more expensive, but the little one, they're less than a couple bucks. So it's worth it to just have new, clean, fresh. It works. So fresh and so clean. And sometimes too, like with repeated use, the cuff doesn't inflate properly, or you're more likely to have it, break or something like that. So new out of the package. Good to go. So so once they have that in place, then we'll do whatever surgery prep they need to do, so shaving, scrubbing, all those sorts of things. They get their actual surgery, they come out of surgery, and then a technician sits with them until they are awake, until we can pull that tube and we know that they're okay. And I'll usually wait till they're kind of picking their heads up a little bit before I'll call the owner and let him know that everything's good.
Yeah. Make sure they're all good before. They do get a heater on their kennel afterwards, because a lot of times their body temperature will drop at least a little during surgery, and so we will put a heater on their kennel, make sure that they stay nice and warm, because I know after I have surgery, I like those hot blankets from the hospital. I will ask for several of them because I love it. But so they get a nice heater on their kennel. And then later we'll take them out to go to the bathroom after they're up and walking around. Most of the time they want nothing to do with it. Sometimes they'll go to the bathroom. We usually tell people we don't need any like blankets or beds or toys or anything like that, because a lot of times just after surgery, or even before sometimes, if they're nervous enough, they will go to the bathroom in their kennels. Yeah. And we don't want to have to send that home with you guys. We'll, have to bag up their little blankie and here you go. So
we'll worry about us washing it and then it gets lost somewhere forever and ever. So.
So we have blankets and towels and things that we put in their kennels, so it's not just this little steel box.
Yeah.
We try to make it nice and cozy.
They get coziness. They do.
Yeah.
So that's the gist of it. Is there
well, then we'll take out their IV catheter.
Yeah.
They get a little Band-Aid on their leg. Sometimes you'll see those when we send them home, just depending on how long ago we took out their IV catheter. And then it's just a little cotton ball and some vet wrap. And then we'll tell you take it off, an hour after you get home, or as soon as you get home, depending on how long it's been. Make sure you take the bandage off. Don't leave it on for a week.
We've had that happen.
Yeah.
We come back for like suture removal or something, and then it's like, why is that?
And their foot's all like blowed up and.
Oh god. It's all nasty and dirty.
Or they'll call us and be like, "This Band-Aid is still on. When am I supposed to take that off?" Well, it's been 4 days. When would you normally have taken off your Band-Aid?
Oh. And that's what's funny. People think it's so different between people and animals. Like, you've gone and had blood drawn, right? They put a little cotton ball, a little piece of tape, or like the Coban, like the vet wrap sort of stuff. When do you get to take that off?
They tell you
it's the same.
Leave it on no longer than 2 hours.
It's the same. God love them.
Well, your dog's foot is like this big. Why did you not call us?
Oh.
He doesn't care.
He doesn't care about anything. He would let you. He would have a big blown up foot, and he'd be fine with it.
Oh yeah.
He'd be like, "I love you, thanks. Thanks for my giant foot, Crystal."
Yeah, he would. Well, he doesn't call me Crystal.
Mom. Aunt Kelly.
Aunt Kelly.
Oh, it was ridiculous.
You
were ridiculous.
Can I just lay here, guys?
So what else? We've talked previously about the discharge instructions, and
Yeah.
it's all written down for you when we go over that when you come to pick up and everything.
Yeah, so stitches say in 7 to 10 days, 10 to 14, somewhere around there. Everywhere's a little bit different. Most of the time you'll leave stitches buried under the skin, so they don't even have to bring them back in for suture removal.
Yeah, I try to, just to save people a trip, because I know it's a pain in the butt getting them in and out of the car and finding the time to do it. So it depends on the location of the surgery. Some of them, like spays and neuters, it's usually not too bad to do that. But we did have a particularly bouncy puppy that I was like, she getting some external stitches, because I feel like needs a little extra reinforcement there.
Yeah.
Or certain locations, like eyelid surgeries and things like that, that's gonna have to have external stitches usually. So those will come out, and we'll take those out in 10 to 14 days. But yeah, that's all in your discharge instructions as well.
Limited exercise for 5 to 7 days, leash walk outside, typical things like that.
Cone of shame.
Yeah, cone of shame for 10-ish days. No jumping up and down off the furniture, preferably no stairs, things like that. Anesthesia, and I will say this over and over and over, it can stay in their system for 24 to 48 hours. Like, they will feel weird. They don't know what happened. Hey, I dropped you off for surgery, or, you went in for surgery. Why you feel weird. Yeah. They don't understand that. So we'll have a lot of people call up even the same night, and they're like, oh, my dog is just whining and crying. I think they're painful. Chances are they're just seeing the white elephants. Like, they don't understand what happened. They don't know why they feel weird. They may not even remember what happened. I know my 6-year-old, after he had his, he had some dental work, he doesn't remember any of it. Like, he doesn't remember having his teeth pulled. He doesn't remember waking up.
No.
He just remembers he went to sleep. He woke up in his bed.
Yep.
And I mean, it was so sad. And I knew, I knew him. But he just kept going, my mouth is, no, as he's crying, because he doesn't know what happened.
Yeah.
And at least with people, you can reason with them and explain why they're feeling the way that they are.
Right.
Your pets, they don't understand. And so they may not want to eat dinner. They may go home and sleep all night. They
may vocalize. That's pretty typical. So they'll usually tell you, just put them in a quiet, dark room, and let's see if they'll go take a little nap and just sleep it off, because that's really the best thing. And then if they're for some reason still having an issue, that's fine. But usually, if they were going to be painful, usually they would have shown us that when they were here. So it's not typically pain that's causing them to vocalize. It's more just they just out of it and drunk, and they don't know what happened. Poor little things. So yeah, I mean, I've had my tonsils taken out. All I remember about that was they put some kind of gas mask on me, and then I don't remember anything. Then I woke up later in the hospital with my mom there. Had my wisdom teeth taken out. Had anesthesia for that. So yeah,
Are you just gonna tell us?
They gave me a shot of.
Then
Well, I'm just saying, I don't remember it. I just woke up feeling funky, and that's all I know. He's ridiculous. Oh man.
He's just holding my face.
Yeah, adorable.
He's so sweet.
So yeah, but if you have any questions about surgeries, about what we're doing and why, or if you're not sure about something, I mean, obviously always give us a call, let us know.
No, we can't call you right before your pet's surgery time and tell you to bring them up. They need to be here at the specified time.
Yeah, like I said, it's all about keeping that flow as consistent as possible to keep things as safe as possible. It's not just because we want to make things difficult for you, I promise.
Plus, it gives them a chance to kind of calm down and relax before they're just thrown into we're doing all of these things to them. So,
yep. But that's all I have this week. Next week, Crystal says, we'll see if she's prepared for this. She's got some things for
you
me.
didn't play a song.
I didn't play a song. We'll play ourselves out then.
Okay. So, are we doing that?
We can do that.
Should I say what we're gonna do?
You can say what we're gonna do.
Okay. So, what we're gonna do?
I ain't got no shame.
I'm gonna bring in things for Dr. Hogan to eat. We're gonna blindfold her. And
Should be great.
she's got to be really trusting of this. And the thing is, you know me, so I don't know. But you know, I won't give you anything like.
Well, it's not gonna be anything like toxic or
Well,
anything
no,
like
it's not
that.
gonna be like dog poop.
No,
or-
but it's gonna be like treats and foods and things.
Yeah. So random foods, random
And then they
dog
get to guess
treats.
what it is.
Yeah. It's gonna be
That
so
should
much
be
fun.
Super fun.
So I think that next week is just gonna be like a fun episode.
Yeah.
We're not really gonna talk about anything veterinary other than
No, we're just
the
gonna be
dog
ridiculous.
treats that I feed you.
Yes.
And there will be dog
I'm
treats.
doing a taste test. Yes.
And she knows that there will be dog treats.
Oh,
and
yeah.
She's approved of it.
I mean, I taste things anyway. We got those new treats and I was like, let me just try.
she's not taking like a giant
take
chunk
a
of
little
it.
nibble off
Yeah.
the corner. I'm like, just bland.
And so
It's
that
how
gave
I've
me
always
the
been.
idea
It's fine.
of you should like try them on the Facebook Live and then guess what they are. And she was like, okay.
Sure.
I was
So
like,
that's-
really?
Yeah. So if Crystal's prepared next week, that's the plan.
Okay.
Now can I play my song?
Sure.
Okay. I
I'm
picked,
safe here.
cool. I picked a really good
You want
song.
to take half
today.
pint?
Come on, Harley.
Go on, Harley. Oh, he wants to dance.
He looks really upset. Half pint.